Wednesday, the Chancellor, Rishi Sunak, is set to confirm nearly £6 billion of funding for the NHS in a bid to tackle the growing backlog caused by the pandemic.
But in the shorter term, it's booster jabs for the vulnerable and over 50s that the Health Secretary is hoping will help the NHS through the winter. And we can speak to the Health Secretary, Sajid Javid, who joins us live on the programme now. Very good morning to you, Mr Javid. Nice to have you on the show. So it must be great reading for you and indeed for anybody who sees it this morning on the front of the Daily Telegraph that there is some modelling by the London School of Hygiene and Tropical Medicine that suggests, it's just one model that suggests, and government have seen it, that without Plan B, which the government and you are resisting bringing in, which is the mandatory face mask wearing and working from home and so on, even without it, the numbers of people getting COVID on a daily basis could drop radically to about 5,000 a day by mid-November. Is that what you are banking on?
I don't think it would surprise you to hear there's lots of modelling all the time. It does change rather a lot. I think rather than sort of banking on anything, I just look at the facts on a daily basis. And from what we are seeing at the moment, of course, case numbers are high, but in terms of our plans about whether we need to move from Plan A to Plan B, we don't think the data supports that at this point.
OK, but so you're keeping it in your back pocket, are you?
Well, we've been really clear, I think, from the start, from a few weeks ago when I set out to Parliament our plans for the winter. And of course, that wasn't just about COVID. There are other health challenges over the winter period. But the Plan A, which is based primarily on vaccines and treatments and testing, is working. But we do, I think, sensibly need to have contingency plans, and that's the so-called Plan B. And we will monitor that daily with our friends in the NHS and others to make sure that we are taking the appropriate action when necessary.
Okay, can we just play you a clip of what you, just a part of what you said on Friday? You were talking about the importance of people going to get the booster jab, and you were saying that if they didn't do that, if they didn't take that seriously, then they risk losing their liberties. This is how you put it.
So many of you that came forward when it was your time. And if we want to secure these freedoms for the long term, then the best thing that we can do is come forward once again when that moment comes.
So that really was pretty much waving the big stick, saying if you don't come forward and get the booster jab, then you will lose your freedoms. And that's quite a big thing for a politician to say in a democracy like ours, isn't it? Do you think maybe you got the tone a little wrong there?
No, not at all. I think my message was very clear, and I'd say it again, in that we all have a role to play in combating this pandemic. It's not over yet. We can see that. It's not over anywhere in the world, and we can see it in our own country. And our role, each one of us, is vitally important in keeping this virus at bay. And what I was referring to there, in particular, as you've pointed out, is the importance of vaccination. The reason why today life is much more like normal versus even a few months ago is because of the phenomenal success of our vaccination program. Almost 80% of people double vaccinated, far more at least one vaccination. And in particular there, I was referring to the booster program, because we're learning more about this virus and vaccinations as each day goes by. We now know that the immunity that you get from a booster does wane over time. And if you're an older person, you're particularly vulnerable to that. And that's why we have the booster program for anyone that's classed as vulnerable or anyone over the age of 50 that's had at least 6 months since their second jab. And we've got a role to play. And the fact is, if we didn't get our boosters when we are eligible, then we will not just put ourselves at risk, but we'll put the whole country at risk in terms of having to go backwards with this pandemic, and none of us want to see that.
Are you not a bit sort of 5 weeks too late with this? Because I mean, you started this then. We haven't seen hide nor hair of the vaccine's new minister. There's a TV campaign now, and there are many people who are saying the online booking system just isn't working. It's just, there are many people, and we've got reams of emails from people this morning saying we just can't book it.
Well, I think actually, from what I've seen, the NHS has actually done a very good job with the booster program, and let me just justify that. We've had, the program started about 4 weeks ago. We've had over 5 million people receive their boosters in England. In just the last 72 hours, we had over 800,000. On Saturday alone, we saw 325,000. So it's picked up pace rapidly. And in fact, if you compare the first week, 4 weeks of the booster program to the original vaccination program, we've seen double the number of jabs, and that's down to the hard work of the NHS and all the people that are coming forward. But what is right is that we do need more people to come forward as quickly as possible, and anyone who is eligible, so if you're over 50 and you've had at least 6 months since your second jab, that you will receive an invitation. But for any reason you don't get that invite, don't worry. If it's 6 months and 1 week, you can go online or dial 119 and get your boost.
But Minister, I can't stress this enough to you, and we're going to send you all of these messages actually to your department so you can read them with your own eyes. We are getting hundreds and hundreds and hundreds of tweets and emails from people who are trying to do what you told them to do on Friday. They are coming forward. They are eligible to have the jab. Many of them had their second jab 7 months, 8 months ago. Some of them are clinically vulnerable and desperately need the booster. And when they go online to register, and they've been told that they're eligible, when they go online to make an appointment, they're told that they're not eligible. It's driving them mad. I would say half of these emails finished with the words, please help, because these people have made endless phone calls. They've gone online endlessly over the last few days, and they just keep being told that they're not eligible. What I'm trying to say to you is there's a fault in the system. You've got a glitch in the system. We pointed this out on the programme last Thursday, and we were told by the Minister concerned he'd go away and fix it. It's still happening. Do you accept that there's a problem here with the booster jabs?
What I will say is two things, and I hope they're helpful, is that first of all, obviously we get many inquiries directly to the department. I get them, as you would imagine, from MPs on behalf of their constituents. And what we are finding is that in some cases there are people that believe they're eligible, but they haven't quite hit the 6 month mark, and that's good to see keenness in this. But it is a requirement based on the recommendation of our clinical experts that you have to wait at least 6 months. And at the moment, though, the booking system does not allow you to book until you've hit 6 months and 1 week. And I actually think that needs to be changed, and we're in the process of changing that. So I want to allow people to book earlier. But I will just gently say to anyone that is looking to book, please make sure that you've hit that 6 month mark, because the system won't allow you to book until then, because until that point, based on the advice we have, you don't need the boost until you hit the 6 month point.
All I can tell you is that they're telling us that they're well over the 6 month limit, and they're still being told they're not eligible. It doesn't make any sense.
And that's why I wanted to, if I may, make a second point that might prove helpful, is that you can dial 119 and then you'll get someone on the other end of the line that might be able to help with that. If there might be, they can't look. There are millions of people that the NHS is writing to every day. Of course, there can be some glitches and some problems, and the NHS will act on those quickly. But the best way to get someone to act on it quickly is to dial 119.
Okay. Mr. Javid, I know you've got to go, but I've got to ask you about mandating NHS workers to have the initial vaccine, the double jabs. There are 7% of them who haven't yet and probably won't. They are now potentially, by you being threatened that they will be removed from frontline jobs. The NHS is already in a staffing crisis. How can you justify that?
Well, I mean, first of all, I say the NHS is doing a phenomenal job, and the reason that happens because everyone that works in the NHS is there for one reason, which is to look after vulnerable people.
Well, yes,
and
it's those hard-working people who have got the freedom of choice at the moment to not have the vaccine, who are being threatened with potentially losing their jobs by you if they don't do as you tell them to.
And it's right that everyone has the freedom of choice about whether they want to take the vaccine or not. But, and it's a big but, is that if you work with vulnerable people, the NHS, the care system, they are at serious risk if you do not take the vaccine. It's not just you are at risk. You're putting those people that are in your hospital, vulnerable people, at serious risk. Now, rightly, the government said to NHS workers, care workers, they were first in the line to be offered vaccines going right back to sort of December, January, they were offered vaccines. If you're still someone actually in the care sector or the NHS sector that hasn't taken a vaccine, then you've done that by choice. And if I may, you said that thousands might leave, or I guess that's the implication of what you say, is that if we look at the care sector, we've already implemented this policy in the care sector. The cut-off date is November 11th. What we've seen is that from the moment we announced it, that it will be a legal requirement, we have seen an absolute surge in the number of care workers that are taking their vaccines, not just protecting them, but the vulnerable people they are with day in, day out. Many countries have done this. I think almost every country in Europe has done this. And I think it's right that we look at doing it in the UK. Okay. I think it's absolutely right.
There we have to leave it. Thank you very much, Minister, for your time.